Right now, 2021, the focus is on the vaccine, but there have been some hiccups along the way with the rollout and actually getting the vaccine and getting it into the arms of the public. With us now on the show, Dr. Russell Faust. He is the medical director for the Oakland County Health Division. 2021, have you had any sleep yet so far?
Sure, it hasn't been that bad. We would like to have a little more vaccine to distribute to people, but we're not pulling the all-nighters like we were back in March, April, May.
Well, that's kind of a silver lining when it comes to the vaccine. Let's just go ahead and start. Obviously, Oakland County did get the coolers that were needed in order to store the Pfizer vaccine. Where do things stand? And can you walk us through the process? How do
Sure.
you actually get the vaccine?
Yeah, we receive our vaccine direct from Pfizer, and that distribution is regulated by CDC, which basically dictates down to the states what their allocation is. And then MDHHS, Michigan Department of Health and Human Services, dictates how that's distributed across the counties in the state. We've been receiving just under 2,000 doses per week, which is a little frustrating, considering that we have redeployed our staff, reallocated our resources in order to bring our capacity up, our vaccinating capacity, to about 20,000 per week. And yet we get only 2,000 per week. We get 1,950 doses per week. So, there's nobody to blame, really. Understand, Pfizer's making the stuff as fast as they possibly can. They're supplying the entire planet with vaccine, just as Moderna is. And, MDHHS gets a limited supply every week, somewhere between 60 and 100,000 doses for the entire state. So, that the fact is, the entire world will be frustrated for a while. Everybody would like to have vaccine right now, and that's just not possible. So CDC and MDHHS have essentially provided guidelines for how to prioritize who does receive vaccine. State announced this week, I don't even know honestly what day it is, but they announced that those who are 75 and older can receive vaccine, 65 and older with chronic health conditions. We have 217,000 residents in Oakland County alone, 65 and older. Even if we just talk about the 1A priority group, we're talking about tens of thousands of people. And we have received, fewer than 2,000 doses per week. As of yesterday afternoon, we have vaccinated 4,669 people. So basically, every dose we receive, we stick in somebody's arm. And so far, that has been primarily EMS, healthcare workers, teachers, and police, sheriffs. And again, we've scheduled every dose that we receive. And right now, because we're trying to anticipate, we're scheduling, people for appointments where we haven't received doses yet. So we have to rely on the state to continue sending us vaccine.
It's like you said, a lot of frustration involved in this, especially when you're talking about you have limited resources, limited personnel, and you're trying to reshift what they're doing and where they're doing it, but then they're now just seems like they're sitting idle while they wait for the vaccine because you don't want to not have them in place.
No. There's nobody sitting idle, trust me. I mean, we've been redeploying community nursing, environmental health personnel, clinic nurses in order to continue our testing regimen that's out at our mobile sites. So we continue to have testing at our 5 sites. We continue to have outreach testing at various long-term care facilities or nursing homes or other group homes, that sort of thing, congregate care settings. And we continue to redeploy them at our testing sites as we receive vaccine and schedule people for vaccination. And let's be clear, these activities are in addition to the usual tasks of public health, managing other outbreaks and epidemics, rabies and enteric diseases, salmonellosis and things like that, Legionella. So, and we still continue to take care of our communities, the Women and Infants and Children's Clinic and our various other clinics, that we conduct, both north in Pontiac and south in Southfield. Nobody's sitting idle.
You're like, we're busy. We're extremely busy. With that, so much of the focus right now, of course, is on the vaccine. But what about testing? Where do things stand with testing? Because, in the beginning, there was the issue of not enough tests. That seems to have worked its way out, and those issues are getting resolved. But there was still a big issue with the accuracy of some of these tests.
Yeah, so how do I say this? There are many people exploiting this pandemic to earn a buck, to make some money. So there are a large number of companies who are marketing tests that are of questionable quality and questionable accuracy. The molecular or PCR test remains the gold standard. That is our go-to. That is the test that we run here in county laboratory. And when we outsource, when we have too many tests to be able to manage in our own lab and we outsource to a third-party lab, we use a lab that conducts the PCR, the polymerase chain reaction molecular test. Many of the rapid tests, if you go out right now, want to get a test, you want an answer today, most likely you'll go to a pharmacy or you'll go to a physician's office or an urgent care. And most likely they'll run one of these rapid antigen tests. And they are much less sensitive. So if you've been exposed, but really not symptomatic, you may be infected, those rapid antigen tests may not detect your infection, whereas the PCR tests are much more sensitive, much more likely. So there's remain some issues there. And, you say, we're told, we hear, we read that there's plenty of tests to go around now, but the fact is, there aren't plenty of the high quality, sensitive, accurate tests to go around.
And what's a turnaround for the PCR test at the labs right now?
So anywhere from 48 to 72 hours out to still well over a week. Depends on the laboratory and whether they've over-obligated themselves, over-committed themselves to customers. And that's a recurring and ongoing problem. We have contracts with 6 laboratories outside of our own. And the early experience is often, they've got a new customer, it's county health, they can turn it around in 24 to 48 hours. That's usable. That still adds value to, epidemiological surveillance. But anything out around 5 or 7 days, that's really not valuable. It's not useful in public health. And so many of them, I should say, end up overcommitted and they end up out at a week turnaround.
Which doesn't even help what we're going through. And with that, Dr. Faust,
Not at all.
a question. So with the vaccine being so limited right now, if an individual has previously had COVID, should they still get the vaccine? And if so, should they wait until it's more readily available?
Great question. So if you're in a priority group and you're offered the vaccine, you should get vaccinated even if you previously had COVID-19 infection. So all you need to do is be recovered from that infection. So you need to be, without symptoms for a couple weeks, and you should get the vaccine if you're offered the vaccine. If you've been exposed and you're in quarantine, you should simply ride out your quarantine, get through that 14-day quarantine, and then get vaccinated if you're offered the vaccine. Absolutely. And I'll tell you another big question that comes up is for pregnant women. So CDC and Pfizer, because they didn't have a large number of pregnant women within the clinical trial, had basically said, check with your healthcare provider. The ACOG, the American College of Obstetrics and Gynecology, has actually issued an advisory and said, no, you should not withhold vaccine just because of pregnancy. If a woman is in a priority group, it's indicated for her to be vaccinated. Pregnancy is not a contraindication. And basically what they're doing is they're weighing the risk benefit. The risk, if someone is in a group where they're at risk of becoming COVID-19 infected and they're pregnant, that's a much greater risk to the fetus and the woman than the vaccine is. So that's their recommendation.
And so with that, there's another question. Can an individual get COVID twice?
Apparently they can. There are some well-documented cases now in the world medical literature of people who have had clearly documented COVID-19 infection, symptomatic, clinical, proven by PCR molecular testing, have cleared their clinical symptoms, have been test negative, and then become reinfected. I think your next question should be, can I get infected with COVID even after I've been vaccinated? And the fact is, yes, you can, even if you've been fully vaccinated. And by fully, I mean both doses 1 and 2 of either the Pfizer or the Moderna vaccine, you can still become infected. So the evidence is that if that happens, your severity of symptoms will be much less than if you're not vaccinated. But this all really speaks to the recommendation that even once you've been vaccinated, you should still practice the mitigation measures, that is, wear a mask and maintain distance from people around you. And there are a couple reasons for that. I think the biggest is that it's not yet clear whether, even after you've been vaccinated, whether you can become infected with COVID-19 and not know it. That is, you could be a carrier, a so-called viral carrier. You can become infected with it, carry the virus, and transmit it to someone else and never be symptomatic, never know it. And so we know, because it's transmitted by respiratory droplet, those who wear a mask don't transmit to those around them. They don't infect people around them. So the recommendation right now, until we get more data, is that even after vaccination, wear a mask, maintain distance. This will help put an end to the pandemic. This will help protect everybody.
Oh, we can't wait till there is an end to this pandemic.
Oh my
and
gosh.
With that, so you were just
Getting old, isn't it?
There you go. And you were just mentioning about people that are asymptomatic. What if someone who is asymptomatic, they're positive for COVID-19, but they don't know it, but they get the vaccine? Will that have any side effects, or is it just unknown at this time?
It's unknown at this time. I appreciate you offering that as an answer. It is unknown at this time. We should talk a little bit about side effects of the vaccine. So historically, most vaccines have an adverse reaction, so let's say an anaphylactic reaction, severe adverse reaction of about 1 in a million. These vaccines, I should say, the mRNA vaccines, both Pfizer and Moderna, have an adverse reaction profile that's greater. Is it like 1 in 80,000, something like that? There have been no fatalities, so that's great news. But people should be aware the symptoms that are expected are fever, headache, fatigue, body aches, joint aches. Those are the big 5 Okay, fever, headache, body ache, joint ache, fatigue. The things that are concerning appear to arise not due to the mRNA, but due to the lipid nanoparticle, the encapsulation of that that's used for the vaccine. And as it turns out, there are lipids in there that are in other things that historically have been considered inert. They're in toothpaste, they're in other medicines, they're in our shampoo. And most of us actually have a few antibodies to those. A small number of us have a high amount of antibodies, and those are the folks that are reacting. So the folks that should not be getting the vaccine are those who have had a very strong reaction to, severe allergic reaction to foods, medicines, any kind of injectable medicine, IV or vaccine.
It's interesting because when you're talking about the side effects, we've interviewed a couple people that have had their second dose of the vaccine. And for them, they were saying really it was nothing on the first one, but it was the second dose where they were, experiencing some of those side effects that you just mentioned, fatigue and the headaches.
Oh, yeah.
Why is that? Why not for the first time, but for the second time?
I think it just tells you that your immune system is mounting a very strong response. And frankly, we don't endorse this yet, but because of that apparently strong immune response after just the first dose, some of the say EU countries and the UK have gone to a single dose strategy for the Pfizer or the Moderna vaccine. And there's early clinical data suggesting that there's actually a very strong response after the first dose. The reason they're doing that, for example, in the UK, is they have just such a horrible surge of clinical cases. They're trying to, put an end to it as soon as possible, as early as possible, and they're trying to double the number of people they can vaccinate. And so taking that second dose and using it as first dose for others.
Yeah, we've heard that even be mentioned here in the United States as possibly, releasing some of those doses because, they're still going to be manufactured. So instead of holding them for the month, you're going to be making more of the vaccine during that time for the people for the second dose, but let's get as many people vaccinated as early as possible.
Yeah, apparently the Biden administration, the Biden-Harris administration have announced that that is their plan, to release all the vaccine instead of holding it back for second dose. And, I think the worst case scenario would be that people that are scheduled to have their second dose at the 21-day mark or the 28-day mark aren't able to get it at that time. So I think worst case scenario, they'll get it later. And again, that has actually been a strategy adopted in some EU countries. I think it's Sweden or Norway that is routinely scheduling second dose out at 3 months. Too early is not good, but too late isn't horrible. It's not a big detriment in a 2-dose vaccine.
So when we talk about trying to get enough people vaccinated to get to herd immunity, I just watched a documentary about the Ebola outbreak in Sierra Leone. And when these pandemics come to an end, what makes that happen? Because we're hearing what now it could be 2021, 2022, but I'm fascinated by it seems to me, even if one individual gets it, couldn't we continue to keep spreading it? How does a pandemic come to an end?
That's a great question. I would refer you, and I'll try to answer it to the best of my ability, but I would refer you to an epidemiologist out of, I believe it's Yale, by the name of Nicholas Christakis. And his expertise is on epidemics and pandemics historically. And so he basically has looked at the natural history, exactly what you just asked about, the natural history of a pandemic over time. Exactly how does it spread through a population, a small population or a large population, say separate populations, separate towns or villages, and what does finally bring it to an end? It's a very interesting question, and I don't think anybody has answered that better than he has. For some of the prior, let's talk about SARS just briefly, or MERS. Those appeared to be pandemics. There was a lot of fear that that would be a global catastrophe. And those viruses, like SARS-CoV-2, the COVID-19 virus, were spillovers, zoonotic spillovers from an animal. Both of those, however, mutated rapidly enough that those epidemics came to an end. Unfortunately for us, the mutation variants in SARS-CoV-2 appear to only have improved its ability to be transmitted from person to person. Doesn't seem to, neither of those covariants or variants have really appeared to change the severity of illness, but the variant that popped up in February, the variant that popped up in the UK, and now another one just popped up in South Africa, these variants appear to improve transmission. Unfortunately for us, none of these mutations have resulted in decreased transmission or infection. So,
Well, at least it's happening in a time when we do have a vaccine, and it appears like as if the
oh
vaccine is
yes,
working on that strain as
yes,
well.
absolutely. And so far, all indications are that those mutations, those variants, haven't changed their susceptibility to those who are immunized with the vaccines. So thank goodness for that.
Just another minute or two here
Yep.
left with you on the megacast. One thing I did see is I think there was a report that the number of flu cases are actually down this year. And really, to me, it's not surprising because we've been, keeping away from one another.
Yeah. I suppose that is one of the few silver linings of this pandemic, and people wearing masks and maintaining distance. And I just want to thank our fellow Michiganders for doing such a great job of listening to the recommendations from public health, because frankly, we did not see the anticipated surge after, for example, the Thanksgiving holiday or the more recent, Christmas, Hanukkah holidays. We're grateful for that. So we've done a great job, I think, across the state.
So with that though, when it comes to family and friends, if everyone in a group has already had COVID, is it okay for them to get together and have a family dinner?
Their risk is certainly lower than, say, not having had a history of being infected with COVID and being in a group of unknowns, or a large group of people. So yes, that's certainly safer. A group of people who have been vaccinated is certainly safer. But again, because of those kind of unknowns that I mentioned earlier, masking and distancing is still important and still the safest. There's no 100% safety. Certainly they're safer than they would be otherwise.
So do you see 2021, let's say next December, will we be back to life as we knew it before? We can have,
Oh man,
family gatherings without a mask and no social distancing.
I think if everybody is vaccinated, I think that will be the case. But I think moving forward, until we've completely eliminated this virus, that is everybody's vaccinated, I think this kind of precautionary behavior of masking and distancing will be with us for a while yet.
So with that, go ahead and keep your mask. Don't be throwing them out anytime soon.
Don't get rid of the mask yet. I should mention people who are in the priority groups: healthcare workers, police officers, teachers, and others in phase 1A and B. Visit our website at oakgov.com. Look for the vaccine button. They can monitor when additional vaccine becomes available. And I want to recommend people should also check with their healthcare systems. The hospitals are receiving the bulk of vaccine for the county or throughout the state. As I say, we receive fewer than 2,000 doses a week. There are hospital systems here, telling us they're vaccinating 3,000 people a day. So check with your hospital system.
Well, good information, and we so appreciate your time. Also, it just helps having people with your knowledge to walk us through the process and to help dispel some of the myths that we see on social media. So it's great having you with us here on the MegaCast.
No, I appreciate the invitation. Thank you.